Newborn constipation is one of the most common concerns parents have regarding their babies in the first 0 to 3 months. Sometimes babies don't make a bowel movement for up to 7 days. Sometimes we even say 7 to 10 days is normal for a baby not to make any stool. It's very concerning for parents because it's normal to have a bowel movement every 1 to 2 days. So it's definitely a common question since it can be so long before the bowel movement. There are some things that you could do to help your baby have a normal bowel movement. And one of them would be bicycle movements with the baby's legs and putting pressure on their baby. Also, rubbing in clockwise circles can be helpful. When a baby comes in to be evaluated for no poop in the first 3 months, we often check temperatures, which is rectal, and some nurses have told me that this is a way to stimulate a bowel movement. Although this may be true in a medical environment, a hospital environment, I don't recommend doing rectal stimulation so much at home, but it is something that nurses do when babies do come in to be evaluated. What you can do is making sure that you're using a diaper cream and applying it to the area. That may also provide a gentle stimulation. There's a product out there called Windy Poo, and this is a product that you insert into the baby's rectum, and it's supposed to release gas. It has a similar idea for the fussy babies, but I'm not a big fan of it, but it is out there over the counter that's available that some parents have asked me about, that you could buy. And then what else? So there's Windy Poo, there's the rectal stimulation, and creams, bicycle movements, and then of course is my trick that I learned from my mentors, which is not actually what I've seen is not really in the literature so much on what is recommended in. We have a resource up to date, but it does work. It is safe, and I do recommend it for parents who are so frustrated with a baby who is having a lot of gas and not having a bowel movement. So it's very simple. So you take dark brown sugar and water. You could use a distilled water, and you mix them in equal parts. So if you have 5 mLs of dark brown sugar and you have 5 mLs of water, you mix them together until they're well blended. And you could give this solution, this dark brown sugar water solution, to your baby who's less than 3 months old to help them move about their bowels. So what this does is it brings the sugar in the digestive system, brings in more water into the digestive tract, and this allows for the passage of stool because more water is going in and it pushes the stool out more easily. You could do up to 15 mLs, which is actually, it sounds a lot, but it's actually not if you consider a shot glass to be 30 mL, so it's half a shot glass. You could do it every day until they have a bowel movement. But keep in mind that constipation is definitely descriptive of the type of stool that you have. So when you come in for your visit, we try to figure out, is it lack of stool and then the baby has a big soft bowel movement, or it's actually hard stool, because hard stool is a whole other idea too. Hard stool in babies less than 3 months old is most likely due to the formulation of the formula. And I do tend to see it more often for hard stool to be on formula babies versus breastfed babies, just because the breast milk is the same consistency every time. That doesn't mean that breastfed babies never have hard stool, but it is more likely in formula fed babies to have a harder stool because of the formula concentration. So what I recommend if you are a formula fed baby in the first 3 months and you're having hard stool is to check how you're making the bottle water, the formula. If it's ready-made, make sure that you're using ready-made correctly and you're not adding anything to it. Sometimes people put brown rice into brown rice powder into the formula to make the baby sleep better. That could cause them to be constipated. Another thing would be when you're making powder formula, putting the powder in first instead of the water in first. And this is a problem because the powder, when it fills up the bottle, it creates extra space in the bottle. So when you're putting the powder in first, you have less room for water. Whereas if you put the water in first, you're putting in the correct amount of water and then you put the powder in. So always make sure that you're putting in the water in first if you're using powder formula, and make sure that the ratio is appropriate. So 2 ounces per 1 scoop. So if you're making a 4-ounce bottle, you will use 4 ounces of water and 2 scoops. Try not to do a 3-ounce bottle because it's hard to measure a 1/2-ounce scoop. And how do you want the scoop to be measured? So ideally, you take the scoop and you make a nice cool scoop and then you level it off. So this is scoop and then leveled off. So make sure that you're doing that. Those instructions are on the box of the formula, and those little tiny details related to making the bottle do change the baby's stomach because this is all they're eating. So we want to be very detailed oriented. If you are having a baby and your baby doesn't care and their baby poop is fine and you're not leveling it off, or you're putting the powder in first and the baby's fine, that's great. Your baby is perfect and you're doing a perfect job. But I'm talking about babies that come with a problem of constipation, and that's one area that we could change. So the brown sugar water, bicycling, the windy poo, rectal temperature, creams, and formula preparation. All tips on how to help your baby with their constipation in the first 3 months of life.